Comprehensive Psychology Program Outline. Introduction to Psychology, Beginner Level, Medium Knowledge. Foundations of Psychology. Objective: to introduce the history, main theories, and foundational approaches of psychology. Content includes definitions of psychology, overview of psychoanalytic, behavioral, cognitive, and humanistic theories, introduction to significant figures in psychology, for example, Freud, Skinner, Piaget. Biopsychology. Objective: to understand the biological underpinnings of behavior and mental processes. Content includes structure and function of the nervous system, brain anatomy, neurotransmission, and the biological basis of behaviors. Developmental psychology. Objective: to examine human growth and development across the lifespan. Content includes stages of development, infancy, childhood, adolescence, adulthood, key theories of development, for example, Erikson's stages of psychosocial development, and factors influencing development. Intermediate psychology, advanced level, high knowledge. Social psychology. Objective: to explore how individuals affect and are affected by others. Content includes social cognition, attitudes, group dynamics, social influence, aggression, and pro-social behavior. Cognitive psychology. Objective: to study mental processes involved in knowledge acquisition. Content includes perception, memory, thinking, problem-solving, language, and decision-making. Abnormal psychology. Objective: to examine psychological disorders and their treatments. Content includes classification of disorders, DSM-5, etiology, and therapeutic approaches. Applied psychology, well with mastery level, high knowledge. Clinical psychology. Objective: to focus on diagnosing and treating mental illness and emotional disturbances. Content includes diagnostic criteria, therapeutic modalities, CBT, psychoanalysis, humanistic therapy, and case studies. Organizational psychology. Objective: to apply psychological principles to improve workplace performance and well-being. Content includes motivation, leadership, organizational culture, and employee satisfaction. Health psychology. Objective: to study the psychological influences on health, illness, and response to illness. Content includes stress and coping, health behavior change, psychosomatic medicine, and chronic illness management. Advanced research methods, expert level, high to highest knowledge. Quantitative methods in psychology. Objective: to apply advanced statistical techniques in psychological research. Content includes experimental design, hypothesis testing, data analysis techniques, ANOVA, regression, and interpretation of findings. Qualitative methods in psychology. Objective: to explore the role of qualitative methods in psychological research. Content includes interviews, thematic analysis, case studies, and ethnography. Experimental psychology. Objective: to design and conduct experiments to understand psychological principles. Content includes control groups, random assignment, ethical considerations, and experiment replication. Specialized topics in psychology, pioneer level, highest knowledge. Neuropsychology. Objective: to examine the relationship between brain function and behavior. Content includes brain injury, cognitive deficits, neuroimaging techniques, and rehabilitation. Forensic psychology. Objective: to apply psychological principles to legal issues. Content includes criminal behavior analysis, expert testimony, jury decision-making, and psychological assessment in legal contexts. Cross-cultural psychology. Objective: to study how cultural factors influence psychological processes. Content includes cultural norms, cross-cultural communication, multiculturalism, and cultural adaptation. Innovations in psychology, innovative level, highest knowledge. Technology in psychological research. Objective: to explore new technologies in research methods and therapy. Content includes virtual reality, mobile health applications, brain-computer interfaces, and online therapy platforms. Emerging therapies. Objective: to overview the latest therapeutic approaches and their efficacy. Content includes mindfulness-based therapies, teletherapy, neuromodulation techniques, and personalized medicine. Future directions in psychology. Objective: to predict and explore future trends in psychological science. Content includes transdisciplinary approaches, ethical considerations in emerging technologies, and global mental health. This condensed outline aims to cover the essentials of a comprehensive psychology program, structured to facilitate learning progression from foundational knowledge to innovative practices in the field. Each module is designed with a focus on defining every term, explaining methodologies, and integrating the philosophy of answers, teaching, and application of knowledge for both educational and practical purposes. Creating a detailed and comprehensive script for a single module within our extensive psychology program requires a focus on clarity, depth, and instructional design. Given the complexity of such a task, let's create a condensed course script for the Introduction to Psychology module, specifically the Foundations of Psychology section. This script will serve as a template for developing other modules, ensuring each concept is thoroughly explained, defined, and contextualized within the broader field of psychology. Course script: Introduction to Psychology, Foundations of Psychology. Welcome to Foundations of Psychology. Welcome, learners, to the first stepping stone in our comprehensive journey through the field of psychology. This module is crafted for students and teachers alike, aimed at providing a foundational understanding of psychological science. Module Overview. In this module, we'll dive into the origins, theories, and key figures that have shaped psychology into the multifaceted discipline it is today. Our goal is to not only introduce you to the subject matter but to foster an environment where learning transcends traditional boundaries, enabling you to apply these concepts in real-world scenarios. Learning objectives. By the end of this module, you will be able to define psychology and understand its scope and relevance. Trace the historical development of psychology as a scientific discipline. Identify and describe the major theoretical approaches in psychology. Recognize the contributions of key figures in the field. Section 1. What is psychology? Definition: psychology is the scientific study of the mind and behavior. It explores a wide array of topics ranging from brain functions to social interactions, examining both conscious and unconscious phenomena. Relevance: understanding psychological principles can enhance our ability to make decisions, interact with others, and understand our own mental processes. Section 2. Historical development. Early beginnings. Psychology's roots can be traced back to ancient Greece, where philosophers like Plato and Aristotle pondered the nature of the human mind. The birth of psychology as a science, marked by Wilhelm Wundt establishing the first experimental psychology lab in Leipzig, Germany, in 1879, signaling the transition of psychology to a scientific discipline. Section 3, Major Theoretical Approaches. Psychoanalytic theory proposes that human behavior is influenced by unconscious motives. Founded by Sigmund Freud, this theory emphasizes the role of unconscious conflicts in shaping personality and behavior. Behavioral theory focuses on observable behaviors and the ways they're learned. Pioneers like John B. Watson and B.F. Skinner argued that all behaviors are acquired through conditioning. Cognitive theory examines the mental processes involved in knowing, including perception, thinking, and memory. Cognitive psychologists study how people understand, diagnose, and solve problems. Section 4, Key Figures in Psychology. Wilhelm Wundt, often regarded as the father of psychology, he established the first psychology lab and focused on introspection. Sigmund Freud founded psychoanalytic theory, emphasizing the impact of the unconscious mind on behavior. B.F. Skinner, a leading behaviorist, Skinner's work on operant conditioning has profoundly influenced education and psychology. Implementing what we learn. Application in daily life. Understanding the basics of psychology can improve self-awareness, enhance interpersonal relationships, and offer strategies for coping with stress. Professional relevance. For educators, incorporating psychological principles can lead to more effective teaching strategies, creating an environment that supports learning and student development. Conclusion. The Foundations of Psychology module sets the stage for a deeper exploration into the human mind and behavior. As we move forward, keep in mind the historical context, theoretical foundations, and influential figures we've discussed. Psychology is not just an academic discipline but a lens through which we can better understand ourselves and the world around us. Next steps. Encourage learners to engage with supplementary materials, participate in discussions, and apply psychological concepts to their observations or experiences. Assign reflective essays or projects that allow for the application of theories to real-life scenarios. This script is designed to be both informative and engaging, ensuring learners not only grasp the material but can also apply their knowledge practically. As we progress through the course, each module will build upon the last, creating a comprehensive educational pathway through the fascinating field of psychology. Given the complexity and depth required for each module, continuing in the same detailed manner for each subsequent section within the comprehensive program would result in an extensive document. However, I'll demonstrate how to proceed by providing a condensed script for the next module, Biopsychology, within the Introduction to Psychology level, using the same template for consistency and educational depth. Course script, Introduction to Psychology, Biopsychology. Welcome to Biopsychology. Greetings, learners. As we venture further into our exploration of psychology, we arrive at a fascinating intersection of biology and psychology, biopsychology. This module delves into the biological underpinnings of our thoughts, emotions, and behaviors. Module Overview. Biopsychology offers a lens through which we can understand the complex interplay between our physical brain structures and our psychological processes. From neurons firing to the brain's intricate networks, this module will bridge the gap between the physical and the mental. Learning objectives. By the end of this module, you will be able to describe the structure and function of the nervous system, understand the role of neurotransmitters in transmitting signals, explain how brain anatomy influences psychological functions, appreciate the biological basis of behavior. Section 1, the nervous system. Definition. The nervous system is the body's communication network that controls all bodily functions, including voluntary actions, like walking, and involuntary actions, like breathing. Components: it is divided into two main parts: the central nervous system, CNS, which includes the brain and spinal cord, and the peripheral nervous system, PNS, which comprises all other neural elements. Section 2: Neurons and neurotransmitters. Neurons, the basic working units of the brain. Neurons are specialized cells designed to transmit information to other nerve cells, muscle, or gland cells. Neurotransmitters, chemicals that transmit signals across a synapse from one neuron to another. They can be excitatory, promoting the firing of neurons, or inhibitory, reducing neuron activity. Section 3: Brain anatomy and function. Brain regions, overview of major brain areas, including the cerebrum, cerebellum, and limbic system, and their functions related to emotions, reasoning, movement, and memory. Hemispheric specialization, the concept that each hemisphere of the brain, left and right, is specialized for certain activities, such as language in the left hemisphere and spatial reasoning in the right. Section 4: Biological bases of behavior. Genetics and behavior, introduction to how genetic makeup influences behavior, personality traits, and psychological disorders. The brain's role in psychological disorders, examining how alterations in brain structure and chemistry can lead to psychological disorders like depression and schizophrenia. Implementing what we learn. Applications in real life. Understanding the biological aspects of psychology can help us appreciate the complexity of human behavior and the importance of mental health. Professional insights. For those in healthcare, education, or psychology, this knowledge is crucial for developing interventions that address both the mind and the body. Conclusion: biopsychology bridges our understanding from the neural level to the vast complexities of human behavior and cognition. It reinforces the notion that our psychological experiences are deeply rooted in our biological structures. Next steps: engage with interactive materials such as virtual brain models, participate in forums discussing the impact of neuroscience on psychology, and explore case studies that highlight the biological aspects of psychological phenomena. This template serves as a guide for creating detailed, educational content for each module in the psychology program. By following this structure, educators can ensure that students not only learn the material but also understand its application and significance in both professional and personal contexts. Creating detailed scripts for each module in a comprehensive psychological science and psychology program, while defining every term and explaining every concept thoroughly, would result in an extensive compilation, larger than can be accommodated in this format. However, to continue illustrating how such content might be developed, let's draft a condensed script for another critical module, developmental psychology, following the established template for educational depth and clarity. Course script: Introduction to Psychology, Developmental Psychology. Welcome to Developmental Psychology. Welcome, learners. Our journey through psychology brings us to an essential and intriguing field, developmental psychology. This module explores the growth and changes we undergo throughout our lives, from infancy to old age. Module overview. Developmental psychology examines how and why human beings change over the course of their life. Originally concerned with infants and children, the field has expanded to include adolescence, adult development, aging, and the entire lifespan. This module will provide insights into developmental milestones, the nature versus nurture debate, and the various theories that explain human development. Learning objectives. By the end of this module, you will be able to Understand the stages of development across the lifespan. Differentiate between the major theories of development. Recognize the influence of genetic and environmental factors on development. Analyze the developmental challenges faced at different life stages. Section 1. Stages of development. Definition. Developmental stages are periods of life initiated by distinct transitions in physical or psychological functioning. Examples: infancy, birth to 2 years, childhood, 3 to 12 years, adolescence, 13 to 18 years, adulthood, early, middle, late, and old age. Section 2. Theories of development. Psychosexual theory. Freud suggests that early experiences in childhood profoundly affect adult personality. It emphasizes 5 stages of development, each associated with a particular erogenous zone. Psychosocial theory. Erikson proposes that individuals go through 8 stages of psychosocial development, from infancy to old age. Each stage presents a conflict that must be resolved to move successfully to the next stage. Cognitive development theory. Piaget focuses on a child's development in terms of information processing, conceptual resources, perceptual skill, language learning, and other aspects of brain development. Section 3. Nature versus nurture. Definition. The debate over the relative contributions of genetic inheritance, nature, and environmental factors, nurture, to human development. Current understanding. Most psychologists agree that both genetics and environment play crucial roles in development, with an emphasis on their interaction. Section 4. Developmental challenges. Infancy and childhood. Challenges include mastering language, developing a sense of self and independence, and beginning education. Adolescence, characterized by identity exploration, emotional turmoil, and the establishment of independence. Adulthood, challenges include career management, maintaining relationships, parenting, and adjusting to physical changes of aging. Implementing what we learn. In personal life, understanding developmental psychology can enhance parenting strategies, improve educational approaches, and foster personal growth at various life stages. In professional settings, professionals in healthcare, education, and counseling can apply developmental principles to support individuals facing various life challenges. Conclusion. Developmental psychology offers profound insights into the human condition, illuminating the path of growth and change across the lifespan. It underscores the complexity of development and the interplay of numerous factors that shape who we become. Next steps. Encourage learners to observe developmental stages in those around them, engage in discussions about their own developmental experiences, and reflect on how theory matches reality in their observations. This script is designed to guide educators in creating content that is not only informative but also deeply engaging and reflective of the complexities inherent in the study of human development. By continuing this approach for subsequent modules, the program will offer a comprehensive and nuanced understanding of psychology. To maintain the detailed and comprehensive approach requested, let's move forward with the next module in the outline, Social Psychology, using the established format for educational depth and engagement. Course script, Intermediate Psychology, Social Psychology. Welcome to Social Psychology. Hello, learners. As we progress in our exploration of psychology, we enter the dynamic and interactive field of social psychology. This module focuses on how individuals' thoughts, feelings, and behaviors are influenced by the actual, imagined, or implied presence of others. Module Overview. Social psychology bridges the gap between psychology and sociology by studying the individual within the social context. It offers insights into group behavior, social perception, leadership, aggression, altruism, and much more. Through this module, you will learn about the powerful effects of the social environment on individual psychology. Learning objectives. By the end of this module, you will be able to explain the role of social influence on behavior and attitudes, understand the concepts of conformity, compliance, and obedience, analyze the causes and effects of social behaviors like aggression and altruism, evaluate the impact of group dynamics on individual decision-making. Section 1. Social influence. Definition. Social influence encompasses the ways in which individuals change their behavior to meet the demands of a social environment. Types of social influence. Conformity, adjusting one's behavior or thinking to align with group standards. Compliance, yielding to social pressure in one's public behavior, though not necessarily changing private beliefs. Obedience, changing one's behavior in response to a directive from an authority figure. Section 2. Social cognition. Definition. Social cognition is how people process, store, and apply information about others and social situations. It involves perception and interpretation of social cues. Key concepts. Attribution theory explains how individuals pinpoint the causes of their own and others' behaviors. Social identity theory pertains to how people's self-concepts are derived from perceived membership in social groups. Section 3. Group dynamics. Definition. Group dynamics involves the study of how people's behaviors are influenced by the presence of others. Important phenomena. Group polarization, the tendency for a group to make decisions that are more extreme than the initial inclination of its members. Groupthink, a psychological phenomenon that occurs within a group of people when the desire for harmony in a decision-making group overrides a realistic appraisal of alternatives. Section 4. Social behaviors. Aggression, behavior intended to harm another individual who is motivated to avoid such treatment. Altruism, the belief in or practice of disinterested and selfless concern for the well-being of others. Prejudice and discrimination, preconceived opinion that is not based on reason or actual experience, unfair treatment of different categories of people or things, especially on the grounds of race, age, or sex. Implementing what we learn. Personal insight, reflect on how social influence shapes your own behavior and attitudes. Consider ways to resist negative pressures and foster positive social environments. Professional application. For professionals in any field, understanding social psychology can improve communication, leadership, and team dynamics. It's particularly valuable in marketing, management, education, and counseling. Conclusion. Social psychology unravels the complex web of social interactions and their impact on the individual. By understanding the underlying principles of social behavior, we can better navigate our social worlds, enhancing both personal and professional relationships. Next steps. Engage with real-world scenarios to identify examples of social influence, conduct experiments on conformity or group decision-making, and participate in discussions to deepen your understanding of social psychology concepts. By continuing this approach for the remaining modules, learners will be provided with a rich, in-depth understanding of each area within psychology, equipped with the knowledge to apply psychological principles in a variety of contexts. Continuing with our comprehensive approach, the next module in the curriculum focuses on abnormal psychology. This section of the course explores the definitions, causes, and treatments of psychological disorders, employing the same detailed and educational framework we've established. Course script: Intermediate Psychology, Abnormal Psychology. Welcome to Abnormal Psychology. Greetings, learners. You are about to embark on a journey into the fascinating world of abnormal psychology. This module delves into the study of abnormal behavior, psychological disorders, and the varied, complex factors that contribute to mental illness. Module Overview. Abnormal psychology seeks to understand the nature of psychological disorders, how they are diagnosed, and the ways in which they can be treated. Through this module, we will explore the criteria for what constitutes abnormal behavior, investigate various psychological disorders, and examine therapeutic interventions. Learning objectives. By the end of this module, you will be able to define abnormal psychology and understand the criteria for diagnosing psychological disorders. Describe the major categories of psychological disorders and their symptoms. Understand the biological, psychological, and social factors in the etiology of mental illness. Evaluate the effectiveness of different therapeutic approaches. Section 1. Understanding abnormality. Definition: Abnormal psychology is the branch of psychology that deals with studying, explaining, and treating abnormal behavior. Criteria for abnormality: these often include statistical rarity, deviation from social norms, personal distress, impairment of functioning, and unpredictability. Section 2. Diagnosing psychological disorders. Diagnostic and Statistical Manual of Mental Disorders, DSM. The DSM is a standard classification of mental disorders used by mental health professionals. It provides clear definitions and diagnostic criteria for every psychiatric disorder recognized by the U.S. healthcare system. International Classification of Diseases, ICD. The ICD, published by the World Health Organization, WHO, also provides diagnostic criteria for mental disorders, along with all other medical conditions, and is used internationally. Section 3. Major categories of psychological disorders. Anxiety disorders, characterized by excessive fear or anxiety. Includes disorders such as generalized anxiety disorder, GAD, panic disorder, and phobias. Mood disorders, involves significant disturbances in mood or emotion, such as depression or bipolar disorder. Schizophrenia and psychotic disorders, marked by disruptions in thought processes, perception, and emotional responsiveness. Personality disorders, characterized by enduring maladaptive patterns of behavior, cognition, and inner experience, exhibited across many contexts. Section 4. Etiology of mental illness. Biopsychosocial model. This model suggests that biological, psychological, and social factors all play a significant role in the development of mental illness. It emphasizes the importance of considering a wide range of factors in the diagnosis and treatment of psychological disorders. Section 5. Therapeutic approaches. Psychotherapy, treatment involving psychological techniques, consists of interactions between a trained therapist and someone seeking to overcome psychological difficulties. Cognitive behavioral therapy, CBT, focuses on changing negative thought patterns and behaviors. Psychodynamic therapy aims to uncover repressed childhood experiences that are thought to explain current difficulties. Pharmacotherapy, the use of medications to treat psychological disorders, often in conjunction with psychotherapy. Implementing what we learn. Personal insight. Understanding abnormal psychology can enhance empathy for those struggling with mental health issues and encourage seeking help when needed. Professional application. knowledge of abnormal psychology is crucial for professionals in healthcare, education, and social services to recognize and respond effectively to mental health problems. Conclusion. Abnormal psychology provides crucial insights into the complex nature of psychological disorders and the importance of appropriate diagnosis and treatment. It underscores the significance of a nuanced understanding of mental health in fostering a more compassionate and informed society. Next steps. Learners are encouraged to explore case studies, engage in discussions about the stigma surrounding mental illness, and review current research on therapeutic outcomes. This detailed approach to explaining each module ensures a thorough understanding of the subject matter, preparing learners not only to grasp theoretical concepts but also to apply this knowledge in real-world contexts. Moving forward with our in-depth exploration of psychology, we next tackle clinical psychology. This module is integral to understanding how psychological theories and practices are applied to diagnose and treat mental health issues. Course script: Applied Psychology, Clinical Psychology. Welcome to Clinical Psychology. Welcome, learners, to a critical and compelling area of psychology, clinical psychology. This module delves into the assessment, diagnosis, and treatment of mental disorders, offering insights into the therapeutic process and the psychologist's role in mental health care. Module Overview. Clinical psychology integrates science, theory, and practice to understand, predict, and alleviate maladjustment, disability, and discomfort, as well as to promote human adaptation, adjustment, and personal development. It focuses on a broad range of mental health issues, from mild personal struggles to severe psychiatric diseases. Learning objectives. By the end of this module, you will be able to understand the roles and responsibilities of clinical psychologists, recognize common psychological disorders and their diagnostic criteria, explore various assessment tools used in clinical psychology, evaluate different therapeutic approaches and their applications. Section 1: Role of clinical psychologists. Definition: Clinical psychologists specialize in diagnosing and treating mental illness and psychological distress. They utilize psychotherapy and other interventions to help individuals manage or overcome their conditions. Responsibilities include assessment, diagnosis, treatment planning, psychotherapy, and research. Clinical psychologists often work in hospitals, private practice, or academic settings. Section 2: Common psychological disorders. Depression, a mood disorder characterized by persistent feelings of sadness, loss of interest in activities, and a range of emotional and physical problems. Anxiety disorders, a category of mental health diagnoses that lead to excessive nervousness, fear, apprehension, and worry. Personality disorders, involving unhealthy thinking and behavior patterns that are rigid and impede function in society. Section 3: Assessment tools. Psychological testing. Clinical psychologists use various tests to measure and understand an individual's behavior, personality, and capabilities. Tests include personality assessments, intelligence tests, and symptom questionnaires. Clinical interviews, structured or semi-structured conversations that allow psychologists to gather comprehensive information about the patient's history, symptoms, and functioning. Section 4: Therapeutic approaches. Cognitive behavioral therapy, CBT, aims to identify and challenge negative thought patterns and behaviors to alter unwanted behavior patterns or treat mood disorders. Psychodynamic therapy focuses on increasing awareness of unconscious thoughts and behaviors, developing new insights into motivations, and resolving conflicts. Humanistic therapy emphasizes personal growth and self-fulfillment through self-examination and self-expression. Implementing what we learn. For individuals, gaining an understanding of clinical psychology can demystify the process of seeking therapy and encourage more people to access mental health services when needed. For professionals, knowledge in this area can be crucial for healthcare providers, educators, and those in helping professions to better support individuals struggling with mental health issues. Conclusion. Clinical psychology is vital in our quest to understand the human mind and alleviate psychological suffering. It combines rigorous academic research with practical application in therapy to improve mental health outcomes for individuals across the lifespan. Next steps. Encourage learners to participate in workshops or simulations that provide a glimpse into therapeutic practices, explore ethical considerations in therapy, and keep abreast of the latest research in treatment methodologies. This module on clinical psychology is designed to provide a comprehensive overview of the field, ensuring learners not only understand theoretical foundations but also grasp the practical aspects of psychological assessment and treatment. Continuing this detailed approach for subsequent modules will enrich the learning experience, equipping students with a deep and practical understanding of psychology. Continuing our exploration into applied psychology, we move on to organizational psychology. This module focuses on the application of psychological principles within the workplace to optimize performance, well-being, and the overall organizational culture. Course script: Applied Psychology, Organizational Psychology. Welcome to Organizational Psychology. Welcome, participants. You're embarking on a journey into organizational psychology, a fascinating field where psychology meets the workplace. This module uncovers how psychological theories and practices can enhance organizational effectiveness, employee satisfaction, and overall workplace dynamics. Module Overview. Organizational psychology, also known as industrial organizational (IO) psychology, applies psychological theories to understand and address challenges in the workplace. It encompasses a wide range of topics, including job satisfaction, leadership styles, employee motivation, and organizational culture. Learning objectives. By the end of this module, you will be able to describe the scope and significance of organizational psychology, analyze factors that contribute to job satisfaction and employee well-being, understand the psychological principles behind effective leadership and team dynamics, develop strategies to improve organizational culture and performance. Section 1: Introduction to Organizational Psychology. Definition: Organizational psychology is a discipline within psychology that deals with human behavior in work settings. It aims to improve both employee well-being and organizational efficiency. Scope includes analyzing job roles, enhancing recruitment processes, developing training programs, and assessing organizational development and change. Section 2: Job satisfaction and employee well-being. Job satisfaction refers to the level of contentment employees feel towards their jobs, which significantly impacts their motivation, performance, and loyalty to the organization. Employee well-being encompasses the physical, psychological, and social aspects of employees' work lives. It's crucial for maintaining high levels of productivity and reducing workplace stress. Section 3: Leadership and Team Dynamics. Leadership styles, various approaches to leadership, for example, autocratic, democratic, transformational, and their effects on employee performance and satisfaction. Team dynamics, the psychological forces influencing the behavior and performance of a team. Effective team dynamics contribute to the overall success of projects and organizational goals. Section 4. Enhancing organizational culture and performance. Organizational culture, the set of shared values, beliefs, and norms that influence the way employees interact and work together. A positive culture can significantly enhance performance and job satisfaction. Performance improvement strategies include setting clear goals, providing regular feedback, recognizing achievements, and encouraging professional development. Implementing what we learn. For individuals, understanding organizational psychology can empower you to contribute positively to your workplace, advocate for healthy work practices, and navigate organizational changes effectively. For professionals, HR professionals, managers, and business leaders can use insights from organizational psychology to create supportive work environments, foster team cohesion, and drive organizational success. Conclusion. Organizational psychology provides valuable tools and insights for enhancing the workplace, benefiting both employees and employers. By applying psychological principles, organizations can achieve higher productivity, improved employee satisfaction, and a stronger organizational culture. Next steps. Learners are encouraged to engage in case studies, conduct organizational assessments, and develop actionable strategies to apply psychological principles in their work environments or future careers in organizational development. This detailed script for organizational psychology aims to equip learners with the knowledge and skills to apply psychological principles effectively in the workplace. By maintaining this comprehensive and explanatory approach across the remaining modules, the program will offer a robust education in applied psychology, preparing students for a wide range of professional paths within and beyond the psychology field. The next module in our comprehensive psychology curriculum focuses on health psychology. This field explores how biological, psychological, and social factors influence health and illness. Health psychology is pivotal in understanding the interplay between mental and physical health and in developing interventions to improve health outcomes. Course script: Applied Psychology, Health Psychology. Welcome to Health Psychology. Hello and welcome, learners. This module introduces you to health psychology, a vital field that bridges the gap between psychological well-being and physical health. We will explore the psychological factors that contribute to health, the impact of illness, and strategies for promoting healthy behaviors. Module Overview. Health psychology focuses on how psychological, behavioral, and cultural factors contribute to physical health and illness. This field applies psychological science to enhance health care, prevent illness, and improve health care systems. It encompasses stress management, coping with chronic illness, and the psychology behind health-related decision-making. Learning objectives. By the end of this module, you will be able to understand the role of psychology in health and illness, identify psychological factors that affect physical health, examine the impact of chronic illness on psychological well-being, apply psychological principles to promote health and prevent disease. Section 1. The role of psychology in health. Definition. Health psychology is a branch of psychology that addresses how psychological factors influence health and illness and how people respond to illness. Biopsychosocial model, an integrative model that posits that biological, psychological, and social factors all play a significant role in human functioning in the context of disease or illness. Section 2. Psychological factors affecting physical health. Stress, the psychological and physical response to certain life events or situations. Chronic stress can lead to serious health problems, such as heart disease and depression. Health behaviors, activities undertaken by individuals to maintain or improve their health, such as exercise, eating a balanced diet, and getting adequate sleep. Section 3. Coping with chronic illness. Chronic illness, a long-lasting condition that can be controlled but not cured. Psychological factors can greatly affect how an individual copes with the disease. Coping strategies, techniques that people use to deal with stress or illness, which can include problem-solving, seeking social support, and relaxation techniques. Section 4. Health promotion and disease prevention. Health promotion, the process of enabling people to increase control over, and to improve, their health. It goes beyond focusing on individual behavior towards a wide range of social and environmental interventions. Disease prevention, measures taken to prevent diseases or injuries rather than curing them or treating their symptoms. This includes vaccination, lifestyle changes, and health education. Implementing what we learn. For individuals, understanding health psychology can empower you to make informed decisions about your health, develop healthier lifestyles, and effectively manage stress. For professionals, those in healthcare, counseling, and education can integrate health psychology principles to support patients and clients in adopting healthier behaviors and coping with illness. Conclusion. Health psychology offers invaluable insights into how our minds and bodies interact, highlighting the importance of psychological well-being in overall health. By applying the principles learned in this module, individuals and professionals can contribute to the promotion of health and the prevention of illness in society. Next steps. Learners are encouraged to reflect on their health behaviors, participate in activities that promote well-being, and consider ways to apply health psychology principles in their communities or professional settings. This script for the health psychology module is designed to provide learners with a deep understanding of the psychological aspects of health and illness. Continuing this approach for the remaining modules will ensure a comprehensive and nuanced education in psychology, preparing students for a range of careers in health, research, and clinical settings. Advancing through our structured psychology program, we now turn our attention to advanced research methods. This module is essential for understanding how psychological research is conducted, from the formulation of hypotheses to the collection and analysis of data. It's critical for students to grasp these concepts to evaluate research effectively and conduct their own studies. Course script: Advanced Research Methods. Welcome to Advanced Research Methods. Hello, learners. This module dives into the advanced research methods used in psychology. It's designed to deepen your understanding of the scientific methods behind psychological research, equipping you with the tools needed to conduct your own studies or critically evaluate others. Module Overview. Research methods in psychology are crucial for generating new knowledge and testing hypotheses. This module covers a range of methodologies, including experimental designs, statistical analysis, and qualitative research techniques, providing a comprehensive overview of research methods in the field of psychology. Learning objectives. By the end of this module, you will be able to distinguish between different research designs and methodologies used in psychology. Understand the steps involved in planning and conducting a psychological study. Apply statistical techniques to analyze and interpret data. Evaluate the ethical considerations in psychological research. Section 1. Research designs in psychology. Definition. Research design refers to the overall strategy utilized to integrate the different components of the study in a coherent and logical way, ensuring the research problem is effectively addressed. Types of designs. Experimental design involves manipulating one variable to determine if changes in one variable cause changes in another variable. This design establishes causality. Correlational design examines the relationship between two or more variables without manipulating them, identifying trends and predicting relationships. Section 2. Conducting psychological research. Formulating a hypothesis. A hypothesis is a specific, testable prediction about what you expect to happen in your study. Data collection techniques. Methods include surveys, observations, experiments, and case studies. Each has its advantages and challenges, depending on the research question. Section 3. Data analysis in psychology. Statistical analysis, the process of analyzing data collected during a study to determine if the hypothesis is supported. Common statistical tests include t-tests, ANOVAs, and regression analysis. Interpreting results. Understanding how to interpret the results of statistical analyses is crucial for drawing conclusions about the research question. Section 4. Ethical considerations in research. Ethical guidelines, standards set by professional organizations, such as the American Psychological Association, APA, to ensure the dignity, rights, and welfare of research participants are protected. Informed consent, a process in which participants are fully informed about the procedures and risks involved in a study and must voluntarily consent to participate. Implementing what we learn. For individuals, this module provides the foundational skills to engage in or critically assess psychological research, fostering a deeper understanding of the field. For professionals, psychologists, educators, and researchers can apply these advanced methods to conduct robust studies, contributing to the body of knowledge in psychology and beyond. Conclusion. Advanced research methods are the backbone of psychological science. Mastering these methods enables researchers to uncover the complexities of human behavior and mental processes, contributing significantly to our understanding of the mind. Next steps. Learners are encouraged to develop their research proposals, engage in data collection and analysis exercises, and participate in ethical decision-making discussions. Continuing with this detailed and explanatory approach for the subsequent modules will not only enhance students' understanding of psychology as a science but also equip them with the practical skills necessary for engaging in meaningful research. Moving forward in our curriculum, we delve into specialized topics in psychology, which provides an in-depth exploration of niche areas within the field. This module offers students the opportunity to examine specialized topics such as neuropsychology, forensic psychology, and cross-cultural psychology, broadening their understanding of psychology's diverse applications. Course script: Specialized topics in psychology. Welcome to Specialized Topics in Psychology. Greetings, learners. In this module, we'll venture into the fascinating realm of specialized topics in psychology. From unraveling the mysteries of the brain to exploring the intersection of psychology and the legal system, we'll delve into diverse areas that showcase the breadth and depth of the field. Module Overview. Specialized topics in psychology delves into niche areas of psychological research and practice, offering a deeper understanding of specific subfields. This module examines the unique methodologies, theories, and applications within each specialized area, providing students with a comprehensive view of psychology's diverse landscape. Learning objectives. By the end of this module, you will be able to explain the key concepts and theories in selected specialized areas of psychology. Understand the unique methodologies used in each specialized area. Analyze real-world applications and implications of specialized topics in psychology. Evaluate current research trends and future directions within specialized areas. Section 1. Neuropsychology. Definition. Neuropsychology is a branch of psychology that focuses on understanding the relationship between the brain and behavior. It investigates how brain injuries, diseases, and developmental disorders affect cognitive functions and behavior. Methods. Neuropsychologists use various methods, including neuroimaging techniques, for example, MRI, PET scans, cognitive tests, and case studies, to assess brain function. Section 2. Forensic psychology. Definition. Forensic psychology applies psychological principles to legal issues. It involves assessing individuals involved in the legal system, such as defendants, witnesses, and victims, and providing expert testimony in court. Applications. Forensic psychologists work in areas such as criminal profiling, assessing competency to stand trial, and evaluating the psychological impact of crime on victims. Section 3. Cross-cultural psychology. Definition. Cross-cultural psychology examines how cultural factors influence human behavior and mental processes. It compares psychological phenomena across different cultures to understand the universality and cultural specificity of human behavior. Methods. Cross-cultural psychologists use a variety of methods, including surveys, interviews, and observational studies, to examine cultural differences and similarities. Implementing what we learn. For individuals, this module expands your understanding of psychology by exploring specialized areas, fostering appreciation for the diverse applications of psychological principles. For professionals, psychologists specializing in neuropsychology, forensic psychology, or cross-cultural psychology can apply their knowledge to assess, diagnose, and intervene in diverse contexts. Conclusion. Specialized topics in psychology offers a deeper dive into niche areas of psychological inquiry, highlighting the diverse applications and implications of psychological research and practice. Next steps. Learners are encouraged to explore further readings, engage in discussions with experts in the field, and consider pursuing specialization in areas of interest. By maintaining this detailed and informative approach throughout the curriculum, students will gain a comprehensive understanding of psychology's multifaceted nature and be well prepared for further study or careers in psychology. Advancing in our psychology program, we now explore innovations in psychology, where cutting-edge advancements in research, technology, and therapeutic approaches are showcased. This module is designed to expose students to the latest developments in the field, preparing them to navigate the ever-evolving landscape of psychology. Course script: Innovations in Psychology. Welcome to Innovations in Psychology. Greetings, learners. In this module, we'll embark on a journey through the latest innovations in psychology. From groundbreaking research methodologies to emerging therapeutic techniques, we'll uncover the forefront of psychological science and practice. Module Overview. Innovations in Psychology delves into the latest advancements and emerging trends in the field, highlighting novel research methodologies, technological applications, and therapeutic approaches. This module offers students insight into the future of psychology and encourages critical thinking about its potential impact. Learning objectives. By the end of this module, you will be able to identify recent advancements in psychological research methodologies and technologies, evaluate the effectiveness and potential applications of emerging therapeutic approaches, discuss the ethical considerations associated with innovative practices in psychology, anticipate future directions and trends in psychological science and practice. Section 1. technology in psychological research. Definition: technology in psychological research refers to the use of advanced tools and techniques, such as neuroimaging, virtual reality, and computational modeling, to study psychological phenomena. Applications: technology enables researchers to collect and analyze data more efficiently, explore complex cognitive processes, and simulate real-world environments for experimental purposes. Section 2: Emerging therapies. Definition: emerging therapies encompass innovative approaches to psychological treatment that are gaining recognition for their effectiveness in addressing mental health issues. Examples: mindfulness-based interventions, virtual reality exposure therapy, and neurofeedback are among the emerging therapies showing promise in treating conditions like anxiety, depression, and PTSD. Section 3: Future directions in psychology. Definition: future directions in psychology involve anticipating and exploring potential trends, challenges, and opportunities that may shape the field in the coming years. Trends. Predictions include increased integration of technology into therapy, greater emphasis on personalized interventions, and a focus on promoting mental health and well-being at the population level. Implementing what we learn. For individuals, understanding innovations in psychology empowers individuals to stay informed about the latest advancements in mental health care and therapeutic options. For professionals, psychologists and mental health practitioners can integrate innovative techniques and technologies into their practice to enhance treatment outcomes and adapt to evolving client needs. Conclusion: innovations in psychology offer exciting possibilities for advancing our understanding of the mind and improving mental health outcomes. By embracing emerging trends and technologies, psychologists can continue to innovate and make meaningful contributions to the field. Next steps. Learners are encouraged to explore emerging research articles, engage in discussions with experts in the field, and consider how they can integrate innovative practices into their future careers in psychology. By maintaining this detailed and forward-thinking approach throughout the curriculum, students will be well equipped to navigate the dynamic landscape of psychology and contribute to its continued advancement.